Hi, my name is Nicole Tompkins, and I'm here to talk to you about cerebral palsy. What is cerebral palsy? Cerebral palsy is a term that refers to a group of neurological disorders that affects a person's ability to move. This condition is due to damage to the developing brain either during pregnancy or shortly after birth. There is no known cure for this disorder. Cerebral palsy can affect body movement, muscle control, muscle coordination, muscle tone, reflex, posture, and balance. Visual, learning, hearing, speech, epilepsy, and intellectual impairments may also occur. Most infants are born with cerebral palsy, and this disorder is permanent and non-progressive. However, some symptoms of cerebral palsy can improve with treatment. Classification of cerebral palsy. The following classifications are based on topographical distribution, which is the body parts that are affected. Monoplegia is only one limb is affected. Diplegia indicates the limbs are more affected than the arms, and it primarily affects the lower body. Hemiplegia indicates the arm and leg on one specific side of the body. Double hemiplegia is all four limbs are affected, but one side of the body is more affected than the other. Paraplegia indicates the lower half of the body, including both legs, is affected. Triplegia indicates three limbs are affected. Tetraplegia, all four limbs are affected, but three are worse than the other. Quadriplegia indicates all four limbs are involved. Pentaplegia, all four limbs are involved with neck and head paralysis and often breathing and eating complications. This is a photo of all the topographical classifications. Classifications of cerebral palsy based on motor function, which is the ability to control your body in a desired manner. The first is spastic cerebral palsy, which is also known as pyramidal. This is the most common type of cerebral palsy. People with this condition have increased muscle tone, which leads to stiff limbs and awkward motor movements. Spastic cerebral palsy is often described by what parts of the body are affected. The second one is non-spastic cerebral palsy, which is known as extrapyramidal. This classification is based on decreased and or fluctuating muscle tone. Movement is also involuntary and can be slow or fast, often repetitive, and sometimes rhythmic. This classification can be broken down into two specific groups. The first one is ataxic cerebral palsy. This condition causes issues with balance and coordination. They are often unsteady with walking, have trouble controlling eye movements and depth perception, and often fine motor skills as writing are impaired. This classification does not produce involuntary movements, though. Dyskinetic cerebral palsy is people with this condition experience problems with controlling their hands, feet, arms, and legs, which makes it difficult to walk or sit. Movements are often involuntary and can be slow and rapid and jerky. Muscle tone is often affected in dyskinetic and can alter throughout the day from tight to loose. Signs and symptoms of cerebral palsy. The early signs of CP usually appear before a child reaches 3 years old. Signs of cerebral palsy are variations of muscle tone from tight to loose, stiff muscles and exaggerated reflexes, or stiff muscles with normal reflexes, lack of muscle coordination, tremors or involuntary movements, slow twisting movements, walking with one foot or one leg dragging, walking on the toes, excessive drooling or problems with swallowing, delays in speech development or issues when speaking, and seizures. Neurological symptoms that can be seen are vision and hearing impairments, intellectual disabilities, abnormal pain or touch perceptions, seizures, oral diseases, or urinary incontinence. Causes of cerebral palsy. Cerebral palsy is caused by an abnormality or disruption in the brain development, usually before a child is born. In many cases, the exact trigger is not known, but contributing factors may be mutations lead to an abnormal brain development, maternal infections that affect the fetus, fetal stroke, which is a disruption of blood flow to the fetus brain, infant infections that cause inflammation in or around the brain, traumatic head injury to an infant, or lack of oxygen to the infant's brain during delivery. Diagnosis of cerebral palsy. Diagnosing cerebral palsy is a lengthy process. If your family or doctor or pediatrician suspects your child has CP, symptoms and signs will be monitored, past medical history will be reviewed, and a physical evaluation will take place. A series of tests will also be ordered to make a diagnosis and rule out other possible causes. Brain scans, EEGs, and laboratory tests for vision, hearing, speech, movement, and intellectual impairments will also take place. Management and medications. There is no known cure for cerebral palsy. However, there are several treatments that will improve the quality of life. These include physical therapy, occupational therapy, speech therapy, braces and other orthotics, devices including wheelchairs and walkers, communication aids, corrective surgeries for anatomical abnormalities or tight muscles. And there's also commonly prescribed antispastic seizure medications, and these are baclofen, Botox, diazepam, dantrolene, Flexeril, Dantrium, intrathecal baclofen, and tizanidine. Cerebral palsy permanently affects body movement and muscle coordination, balance, posture, reflexes, motor, and oral skills. Some people may be in a wheelchair or crutches for their whole life, while the location and severity of the impairment varies from person to person. One side of the body will function slightly better in this disorder. Benefits of physical activity. Exercise controls weight, reduces risk of cardiovascular disease, reduces your risk of type 2 diabetes and metabolic syndrome, reduces risk of some cancers, strengthens your bones and muscles, it improves your mental health and mood, improves your ability to perform everyday tasks and limit falls, and it increases your chances of living longer and your overall health. Cerebral palsy and exercise. During exercise, modifications will need to be made based on the person's functional mobility type, number of associated conditions, and degree of mobility of each limb. Cerebral palsy may include sensory or cognitive disabilities that may limit participation and must be taken into consideration as much as their motor limits. Convulsions, seizures, fatigue, and cognitive impairment must be taken into consideration as possible limitations before exercise is tested and prescribed. My case study is Tom. He's an 18-year-old male. He has cerebral palsy. Tom's cerebral palsy has been classified as mild spastic diplegia. Tom has no family history of cardiovascular, metabolic, or pulmonary diseases. Both of his parents are within normal BMIs and resting heart rates. Both of his parents have full-time office jobs and want to join a gym to become more active. Tom is currently using crutches but is not progressing to wheelchair dependency. He attends physical therapy and occupational therapy twice a week. Tom has been in the Friday Night Club, which is a teen activity group for those with cerebral palsy, for the past 5 years. The teens play sports, they go for nature walks that are about 15 to 20 minutes, they see movies, they attend plays and musicals, they complete crafts, and they attend other events for those with CP. Tom is prescribed dantrolene to relax his muscles, and so far he's only experienced mild drowsiness after taking it. Both his parents and physical occupational therapists would like him to be in an exercise program to improve his muscular strength, range of motion, and to keep him healthy. ACM risk stratification. Tom is 18 years old, which is not a risk. His height and weight, he's 5'4", 145 pounds with a BMI of 24.9, which is not a risk. He has no past family history of cardiovascular, metabolic, or pulmonary disease, so that's not a risk. His resting heart rate is 72 beats per minute, and his blood pressure is 122/78 millimeters of mercury, which is not a risk. His TC is 126, his LDL is 76, his HDL is 56, his total glucose is 138, and his BG is 86, and none of those are risks. He attends physical and occupational therapy. He participates in some sports and nature walks, which are 15 to 20 minutes at his Friday night club, but he will be considered sedentary due to participating less than 30 minutes of physical activity 3 to 4 times a week. With his risks, he only has one, so he is considered low risk by the ACSM risk stratification. Special considerations for those with CP. The exercise program should change consistently with changes in muscle tone, rehabilitation, and medical interventions. Modifications need to be kept in mind depending on the effects their condition is imposing on their body that time and day. Good positioning on the head, trunk, and proximal joints of extremities is advised. Limb aids such as Velcro gloves can be implemented to help with equipment if the patient has trouble gripping. Be aware that CP individuals are susceptible to overuse injuries, contractures, and joint pain. Be sure to keep cognitive disabilities in mind and review the reasoning and benefits of specific exercises and movements. Exercises and physical activity should be started gradually with close professional supervision. For our exercise testing for Tom, for cardiovascular, we will do an arm ergonometry. This is the easiest to control and the results are easy. We would do a wheelchair ergonometry if needed. For our protocol, we will start with 0 to 15 watts at 30 to 50 miles per hour. We will increase 5 to 10 watts every 1 to 2 minutes until fatigue is reached. For musculoskeletal, we would do a 1RM to determine his strength and endurance. We will use free weights and field tests to determine strength. Pushing and pulling, lower body, and core endurance will also be tested. For flexibility, we'll use a goniometer. We will test his shoulder, hip, elbow, wrist, ankle, knee, cervical, and thoracolumbar range of motion due to his stiff limbs. For balance, field tests with and without the crutches will be performed. For our exercise prescription, there is no specific recommendations for patients with CP. We will follow the same principles for an apparently healthy person, but make modifications based on condition details. And Tom is at risk for muscle tightness and limited range of motion, so we must focus on improving the mobility of the muscles that are limiting daily life and activities. For our specific prescription, for cardiovascular, we will do walking, low impact, at 40 to 60% of his estimated peak VO2. Other aerobic options that we will include will be arm cycling, chair aerobics, stationary bike, jogging, swimming, and water aerobics. We will start at 3 days per week and work up to 5. We will start at 15 minutes per section, work up to 20 to 30 minutes. And to minimize joint and muscle pain, we will start with low impact and non-weight bearing. For our resistance, we will use free weights, but to begin, we will start with resistance band, weight machines, and medicine balls to learn the basics. We will perform this 2 to 3 times per week at 1 to 3 sets with 8 to 12 repetitions. We will do low to moderate intensity depending on the conditions of the disorder that day, and we will look to target major muscle groups. For our flexibility, our stretches will be static or dynamic, and they will reach a point of tension but not pain. We will do this 2 to 5 days a week, hold each stretch for 10 to 20 seconds, and perform it 2 to 3 times. We will be targeting major muscle groups. For our balance, we will do 2 to 3 days per week for about 10 to 20 minutes. We will be practicing difficult postures as well as dynamic movements that alter the center of gravity. In conclusion, exercise is beneficial for improving one's health and overall quality of life. When working on prescribing exercise for those with cerebral palsy, be mindful of their conditions and make the modifications they need to succeed. And people with cerebral palsy can be just as physically fit as an apparently healthy person. So if you do have a disorder, don't give up. And these are my references. Thank you.